about health care, and most of it has to do with insurance. What I'm sharing with you today are 12 specific ideas on how to bring down the cost of health care and make it more accessible. We've got to start dealing with the realities of what it takes to take care of ourselves without putting more of the burden on the taxpayer. Now, we have real problems in this country. We keep escalating the costs and we have no controls over those costs. We have needs to get in when we're sick or injured and can't, either because the doctor doesn't have a place on his schedule, or because we don't have health insurance, or because the emergency room is full. Whatever the reason is, we need to be taken care of when we're first sick or injured before it becomes a major crisis. So what I've outlined is 12 specific things that are very practical. They're at the local and state level. Rather than talk about what's the federal government going to do for us, how are we going to get Medicaid to work, how are we going to get Medicare to work, how are we going to have some insurance company look out for us, we have to look out for ourselves. So first is preventive health care. We have to deal with exercise and diet, obviously, is first and foremost. Each one of us is responsible for our own care and our own health. In medical school, I found that we have about the same number of physicians now as we did 30 years ago. Medical schools around the country are paid for by taxpayers. We have money by the state legislature in the state of Kansas. We have as much money spent for KU Med Center, $270 million, as we do for 4 of our region's institutions. That includes Wichita State, Pittsburgh State, Emporia State, and Fort Hays. Those 4 institutions, the region's colleges, get less money than KU Med Center. KU Med Center has about 750 students. Now, you go figure. How's that supposed to make any sense? The same number of students are admitted now as were 30 years ago, but the population of Kansas has increased, and so have the aging population. So we have a real dilemma here. We've allowed a group of people to basically educate the doctors, control the supply. When you do that, costs go up. So what I'm proposing is simple. We have a fall and a spring class of students. We do that for every other profession. You can go and enroll in almost any other area of engineering or nursing or anything else. You can enter at the fall or spring. We have the facilities, we have the budget, we have the faculty. Let's use it. The next thing would be to deal with the area of primary care. 80% of the needs of our population for health care are earache, sore throat, broken arm, fractured foot, whatever. Those are primary health care needs. Those are the things that most of us realize. We can go into a doctor's office, they're going to say, well, nurse, take care of this guy or this gal. And you go in, the nurse puts a splint on, they take care of your temperature, they check your ear and see if it's infected. All those things that we take care of ourselves with the primary health care needs are 80% of the whole population of health care problems. And yet we go through this system as if everyone has to go through first a whole maze of people to even get in to see the doctor. Now, what is happening not only in Kansas with Walgreens, as you probably know, but other places now are opening storefront clinics. So when you go in and get prescription filled, you can also get your ear checked. You can get your temperature checked, your blood pressure. You can have a chance to take care of that cut on your hand before it becomes infected and starts becoming gangrene. We have to start making it more accessible for people to get in for health care. And we can do that by a very simple change to the law. State law right now prohibits nurses from doing much more than under the supervision of a doctor. But by changing that, one phrase in the statute right now, we can allow the nurses to go ahead and provide service. These are qualified nurse practitioners or the physician assistants, to be able to say, all right, I now see that you need such and such medication. Here's your prescription, go down and get it filled. Or secondly, looks like we need a lab test here. I'd like to have you go down and have an EKG or have a urinalysis or whatever. And you come back and you check it out, and sure enough, you got a problem, here's the solution. rather than have to have a physician sign off on the prescription or sign off on the lab test, and then see the results back through the physician before it ever gets back to the person providing the care. There are too many layers, and every time you add layers to a delivery of a service, you add cost, and you delay the service. Now, one of the problems that drives up costs is malpractice insurance. Our doctors, of course, are people. They make mistakes. And occasionally it is malpractice. They just were too quick to do what they did, and they really screwed it up. Now, we don't want that to happen. We don't want it to happen in any case, whether we're teachers, insurance agents, real estate brokers, whoever. In medical care, we take it extremely personally. And so the lawsuits against doctors really sometimes bring in high income from the attorneys that bring the suit, and sometimes it actually benefits the patient who was offended. What I'm proposing is that we have a statewide pool, that all of the healthcare providers in the state, physicians, nurses, pharmacists, are able to be covered by one policy. What you're doing there is you drop the risk, and therefore you also drop the insurance premiums. The lower the risk, the lower the premium, the lower the cost to the patient. Those three things in cascading format give you a chance to really start seeing some trade-offs and an opportunity to have protection, the insurance the doctors need for malpractice. At the same time, it lowers the cost for them and lowers the cost to us. Now that again is a state kind of decision, isn't it? It's something as a state we can take charge of, we can have that insurance pool. The prices of insurance are so high that many people can't afford it. I think about 47 million people in our country right now do not have health insurance. I think that the problem really is how that insurance is sold and how we go about minimizing the risk. What I'm proposing is that we have a statewide policy. Now you'll have various policies within that. You can have probably 8 or 9 different plans that you can choose from. But as a state, rather than have the policy tied to the employer, and your small group of maybe 8 to 10 people, or if it's Boeing, several thousand people, you have a statewide policy. And this allows, again, you lower the risk, you lower the premium, you lower the cost. So like we talked about with physicians, the healthcare providers, now you have a chance for those people who are in the actual need for the insurance, the patients, to have a similar kind of situation. By lowering the risk, you lower the premium, you lower the cost. Now more people can afford to have insurance, and more people can afford to change jobs. You're not tied to the employer's policy. The policy goes with you. It doesn't stay with your small group with that. Now, another item that brings us the question of fees. I don't know any other part of the world in our economy where we have to come into a business and say, I need such and such, and we give them a blank check. Why is that? Why did we ever get to the place where we say, all right, doctor, I'm sick, please take care of me, and he says, okay, and then you come out to the other end of that process and you say, well, what do I owe you? You should know that up front. When you went to this line tonight, you had a meal, and they told you up front, here's the menu, here's the prices, you make a selection. You decide what you're going to eat, how much you're going to pay. If I'm going to buy a car, if I'm going to buy a house, if I'm going to buy anything in this country or any place in the world, I generally know ahead of time what it's going to cost. We need to know that in healthcare. We need transparency. We need to know beforehand to make sound, educated decisions about what to spend and how to make the best use of the services available. And that can be done. And that can be done, again, at the state level. You don't have to wait on Congress to make that decision.